Definition of occlusion. Occlusion. The static relationship between the incising or masticating surfaces of the maxillary or mandibular teeth, or both analogs, GPT-8. Number 2. Requirements of complete denture occlusion. 1. Cutting and shearing efficiency of incisal and occlusal surfaces with sluiceways for escape of food. 2. Minimal areas of contact for reduced force on ridges during mastication. 3. Favorable tooth-to-ridge crest position for functional lever balance. 4. Reduced posterior cusp height to control horizontal forces. 5. Reduced buccolingual width of posterior teeth to decrease forces transmitted to residual ridge. 6. Should have a surface to direct the forces of occlusion vertically. 7. Occlusal forces should be directed towards the anteroposterior center of the ridges. 8. Occlusal plane parallel to the mean foundation plane. 9. Allow settling of denture bases without interference or locking of cusps. 10. No anterior teeth contact except during protrusion by providing adequate vertical and horizontal overlap and flat incisal guidance. 11. Stability of occlusion in centric and eccentric relations. Number 3. Types of complete denture occlusion. The 3 important types are A. Balanced occlusion, B. Monoplane occlusion, C. Lingualized occlusion. Balanced occlusion. Definition: balanced occlusion. The bilateral, simultaneous, anterior and posterior occlusal contact of teeth in centric and eccentric positions, GPT-8. Balanced occlusion in complete dentures is unique as it does not occur with natural teeth. If it occurs in natural teeth, it is considered as a premature contact on the non-working side and is considered pathological. Importance of balanced occlusion: it enhances the stability of the denture. The concept was originally put forth to enhance the retention of complete dentures during mastication. Even a grain of food on the working side eliminates balance on the non-working side. This was arbitrarily termed enter bolus, exit balance by Shepard. Balance is now deemed necessary during many excursive movements like swallowing saliva, closing to reseat dentures, and bruxism. Mastication is performed only for about 10 min during the day, while other eccentric contacts occur for hours during the day. In the absence of balance, the bases could shift, leading to accelerated bone resorption, soreness, and inflammation. Many patients enjoy comfort only when eccentric balance is present. Equal contact of all posterior teeth in centric occlusion in centric relation is essential to the health of the mucosa. Lever balance. Liver balance. This is the relation of the tooth to its base of support. It is important when a bolus of food is placed in between the teeth on one side and a space exists on the opposite side. It is enhanced by placing the teeth such that resultant direction of force on the chewing side is on the crest or slightly lingual, placing the teeth close to the ridges, denture base covering as wide an area as possible, reducing the buccolingual width of the teeth. Factors affecting balanced occlusion, Hanaus-Quint. The 5 factors affecting occlusal balance are: 1. Condylar guidance definition. The mechanical form located in the upper posterior region of an articulator that controls movement of its mobile member, GPT-8. Condylar guide inclination. The angle formed by the inclination of a condylar guide control surface of an articulator and a specified reference plane, GPT-8. It is the mandibular guidance generated by the condyles traversing the contours of the glenoid fossa. It is duplicated in the articulator. Protrusive condylar guidance is obtained using protrusive records. Lateral condylar guidance is obtained using Hanaus formula or lateral records. It is expressed in degrees. It is the only factor obtained from the patient and is not under the dentist's control. Shallow condylar guidance causes less posterior tooth separation and requires shorter cusps and flatter fossa than steep guidance. Number 2. Incisal guidance definition. The influence of the contacting surfaces of the mandibular and maxillary anterior teeth on mandibular movements, GPT-8. Incisal guide angle. The angle formed with the horizontal plane of occlusion and a line drawn in the sagittal plane between the incisal edges of the maxillary and mandibular central incisors when teeth are in maximum intercuspation. It is expressed in degrees. It is established during try-in. A steep angle requires steep cusps, steep occlusal plane, and steep compensating curve. This is detrimental to denture stability. Therefore, it should be as flat, close to 0 degrees. as aesthetics and phonetics will permit. It should never be greater than condylar guidance. When steep vertical overlap is recompensating, horizontal overlap should be given to reduce the incisal guide angle. Number 3. Orientation of occlusal plane. Occlusal plane, the average plane established by the incisal and occlusal surfaces of the teeth. Generally, it is not a plane, but represents the planar mean of the curvature of these surfaces, GPT 8. Anteriorly, it is established by the height of the lower canine, which nearly coincides with the corner of the mouth. Posteriorly, it is established by the height of the retromolar pad. It is also related to the allotragus line. It should be oriented in the same relation as when natural teeth existed. Number 4. Compensating curves definition. The anteroposterior and lateral curvatures in the alignment of the occluding surfaces and incisal edges of the artificial teeth that are used to develop a balanced occlusion, GPT. A steep condylar guidance requires a steep compensating curve for occlusal balance. Anteroposterior curve, curve of Spee. It begins with the cusp tip of the mandibular canine and follows the buccal cusps of premolar and molar teeth, continuing through the anterior border of the mandibular ramus and ending at the anterior most portion of the mandibular condyle. Ferdinand Graf Spee, 1890. It assists in obtaining protrusive balance. Mediolateral curves. Curve of Wilson, convex downwards. Used for arrangement of molars. Named after George Wilson, who described it in 1911. Reverse curve or anti-Monson curve, convex upwards. Usually used to arrange the first premolars. Curve of Monson. Each cusp and incisal edge touches or conforms to a segment of the surface of a sphere 8 inches in diameter, with its center in the region of the glabella. Number 5. Cuspal inclination. Definition. The angle made by the average slope of a cusp with the cusp plane measured mesiodistally or buccolingually, also called cusp angle, GPT. It affects the occlusal plane and compensating curves. The closer a tooth is to incisal or condylar guidance, the more influence that guidance has on the cuspal inclination of that tooth. In anatomic teeth, it is preferable to eliminate the mesiodistal cusp height so that only buccolingual inclines need to be considered for balanced arrangement. Hanau's quint. Must remember C. IOCC. Condylar guidance. Incisal guidance. Occlusal plane. Cuspal inclination. Compensating curve. Thieleman's formula. Boxed frac. Condylar guidance. Incisal guidance. Text. Occlusal plane. Cuspal inclination. Compensating curve. B. Monoplane occlusion. Definition. An occlusal arrangement wherein the posterior teeth have masticatory surfaces that lack any cuspal height, GPT 8. Uses non-anatomic teeth. Eliminating cusps reduces lateral forces on the denture, thereby enhancing denture stability. Anterior teeth are arranged with 2 mm overjet and no overbite. Balanced occlusion in eccentric relations is not part of the scheme, but it may be developed using compensating curves and balancing ramps. The number and buccolingual width of posterior teeth are reduced to direct forces toward the center of the ridge. Teeth are not placed on inclines in the second molar area. Advantages. Easy to arrange the teeth. Simple non-adjustable articulator is sufficient. Easier occlusal scheme in difficult centric relation records due to muscle incoordination, skeletal malocclusion, severe residual ridge resorption. Disadvantages. Poor appearance due to non-anatomic teeth, reported less chewing efficiency, unstable dentures in patients with steep condylar guidance. C. Lingualized occlusion. Definition. This form of denture occlusion articulates the maxillary lingual cusps with the mandibular occlusal surfaces in centric working and non-working mandibular positions. The term is attributed to Earl Pound, first described by S. Howard Payne in 1941. It combines balanced occlusion and monoplane concepts. Anatomic teeth are used in the maxillary arch. Non-anatomic teeth are used in the mandibular arch. Only the palatal cusps of maxillary teeth contact mandibular teeth in centric and eccentric relations. All 5 factors involved in balanced occlusion play a similar role. Meyerson lingualized integration, MLI, is a mold specifically produced for this concept. Advantages. More natural appearance of upper premolar teeth. Better chewing than monoplane occlusion. Disadvantages. More challenging teeth arrangement than monoplane. No scientific data to show improved stability. cannot be applied to difficult situations, such as muscular incoordination, severe ridge resorption, and mal-related jaws. The 30-second framework to memorize. If you blank out in the exam, remember this chain.